What is mental illness? Mental illness or a mental disorder is a diagnosable condition that affects a person's thinking, emotional state, and behavior, disrupts the person's ability to work, to carry out daily activities, and to engage in satisfying relationships. When someone's thinking, feeling, or behavior is outside the norm and is disruptive to their ability to do these things, we think it's possible that person has a diagnosable mental illness. About 1 in 5 U.S. adults experience a mental illness each year, 1 in 20 have a serious mental illness, and 17% of youth, ages 6 to 17, have a mental health disorder. The most common adult conditions over 12 months are anxiety disorders, 19%, depression, 8%, co-occurring substance use and mental illness, 8%, PTSD, 4%, bipolar disorder, 3%, and about 1% each for schizophrenia, borderline personality disorder, and OCD. Overall, 23% of adults experience any mental illness, with higher rates among American Indian Alaska Native, 27%, multiracial, 35%, and lesbian, gay, and bisexual adults, 50%, and lower rates among Asian adults, 16%. The graphic also points to ways to seek help. Talk to a health professional, call the NAMI helpline, 800-950-NAMI, connect with friends and family, or join a support group. The infographic highlights major consequences and impacts of mental illness. About 10.2 million U.S. adults have co-occurring mental health and addiction disorders, and depression is the leading cause of disability worldwide. In the U.S., roughly 26% of homeless adults in shelters have a serious mental illness. 24% of state prisoners have a recent mental health history, and serious mental illness costs about $193.2 billion in lost earnings each year. It also notes that 90% of people who die by suicide have an underlying mental illness, with suicide the 10th leading cause of death. These numbers are a few years old, but this points to the complicated nature of mental health concerns. Not every symptom that looks like mental illness is caused by a mental illness, and many symptoms overlap across different conditions. Similar signs can stem from medical issues, for example, brain tumors, seizure disorders, thyroid problems, substance use, misuse, or dependence, medication effects or side effects. So, ruling out other causes is essential before diagnosing. Addiction and mental illness is a complex relationship. Sometimes substance use and mental illness show up at the same time just by chance. Using substances can also trigger mental health problems or make existing ones worse. The flip side happens too. Mental illness can lead someone to use more substances or use them in riskier ways. In some cases, a third factor like trauma or a medical condition drives both. And remember, substance use or withdrawal can look a lot like mental illness, so it's easy to confuse the two without a careful assessment. Why mental health first aid? Mental health challenges are very common. Unfortunately, there's still a lot of stigma around them. Many of us don't have accurate information about mental health, and professional help isn't always easy to access. When something happens, people often aren't sure how to respond. Because of all this, many people who are struggling don't reach out for help, even when they really need it. Mental health first aid, action plan, assess for risk of suicide or harm. Listen non-judgmentally, give reassurance and information, encourage appropriate professional help, encourage self-help, and other support strategies. We absolutely have to listen and reflect on what someone is saying in order to validate how they feel. The actions may be right or wrong, but the feelings are valid and deserve to be heard, whether sad, happy, out of control, whatever. We work to validate other people until they feel like they're being heard. We can tell someone is feeling validated. That person will have some sort of relief and release, like a sigh of relief. How do we talk to people who are mentally ill? Don't try to talk someone out of a delusional belief because you can't. If they say they're hearing voices, just go with it. You also don't want to validate that. You don't want to say they're crazy either. You can acknowledge what they're saying, but don't agree or disagree. First, focus on the relationship. Slow down, listen, and earn trust. Then help the person name what the crisis actually is and ask how they usually cope when things feel this hard. From there, walk through the options together. What could they do next? You can even include the out of control option, talk through the consequences, and then step back to look at the bigger picture so more constructive choices come into view. When people feel heard, they're more willing to consider those options. If professional support would help, point them to the right resources and offer to make the connection. Above all, respect their freedom to choose. You're validating their experience, expanding the choices they can see, and honoring whatever decision they make. When things heat up, keep your voice steady and your body language calm. Show that you're here to understand and help. Speak in simple, clear sentences and move slowly. Be empathetic and try to clear away distractions or ask disruptive people to step back. What you don't want to do is overreact or touch the person. Keep your focus on them. Show you're paying attention. Help them save face, and if you can, offer a sense of hope. Give plenty of personal space. Remember, they might be overwhelmed by sensations, thoughts, beliefs, or voices. Be friendly, patient, accepting, and encouraging, while still staying firm and professional. Here are some de-escalation phrases you can use. I want to help. How can I help? This can be worked out. I need your help. That's good. I don't want anyone to get hurt. I know you don't want to hurt anyone. Try to avoid sudden movements, rapid commands, or shouting. Don't push them into a debate or force a discussion. Skip the stare down. Avoid direct, continuous eye contact. Don't touch them. Keep your own anger, impatience, or irritation in check. Avoid sarcasm or making jokes at their expense. And don't crowd or corner them. Leave a clear path and some breathing room. Don't assume silence means they can't hear you. Avoid talking about them to others as if they aren't there. Be honest. People notice and remember when they're lied to. Skip inflammatory words like crazy, psycho, or mental. And if they share delusional or hallucinatory experiences, don't argue with them. But don't validate the content either. Acknowledge how it feels and steer back to safety and support. Avoid tacos when helping someone in crisis. TACOS stands for threaten, argue, challenge, order, shame. If the de-escalation isn't working, stop, don't force it. If the situation feels unsafe, leave or call for help. Watch for red flags that call for an urgent response. If someone is making violent threats or acting violently, treat it as an emergency. Take any suicide attempt or threat seriously. Severe intoxication can be dangerous and needs immediate attention. So can highly disorganized or aberrant behavior, like wandering, rambling incoherently, being nude in public, or repeatedly trespassing. In many psychiatric emergencies, the safest outcome is reached through informal resolution, and studies suggest this is the most common path. You might start by finding a trusted person to take the individual home, offering a referral to outpatient services, working through the conflict on the spot, or contacting family members to help. If the situation is unsafe or the person needs immediate psychiatric evaluation, you can call police or EMS for transport to a psychiatric emergency department for potential civil commitment. And if there's criminal behavior that can't be resolved another way, police may proceed with an arrest. Always follow your local policies and prioritize safety. Here's a quick psychological first aid checklist for psychiatric emergencies. Look, scan for urgent medical needs, call 911 if needed, ensure the scene is safe and you're prepared, get consent, and note any severe distress. Listen, help the person feel calm. Ask what they need right now, and listen for red flags like intense distress or suicide risk. Link, help with basics and services, offer practical assistance and clear information, connect them to loved ones/social supports, and debrief with someone afterward.
Hi, can I help you?